Key factors to trying to get a good scar is, first of all, placement of the incision, placing it in places where it falls in shadows or is hidden from view from the front. Trimming the skin when it's not under tension, just taking the slack out of it, but in a comfortable position and being very precise about trimming it. I kind of liken it to tailoring. So we're actually, trying to trim the skin in a way that fits the contours as closely as possible, and putting some sutures underneath at key positions to hold it into position, and then bringing it together. So a wound that is not under a great deal of tension usually will heal rather well, especially in the facial area because there's good circulation there. So those are definitely techniques that we use. The stitching sometimes can be also a technique to try to keep the skin edges in approximation, or even with a little bit of eversion, so that over time it will kind of flatten down. It's always easier to work on a scar that's maybe slightly elevated anyway than it is if the scar is depressed. Generally the face heals very well, and as long as you are careful about where you trim the skin and how you put it back together again. Wound care afterward is very important, and so we instruct our patients and demonstrate for them how to clean the incisions. It's not hard to do, but it is an essential thing to do, and so we want them to clean over the incisions, remove all old ointment, and reapply new ointment after they've cleaned it and dried it, and that helps it to heal better, and not put anything else on it. There's magic potions out there for healing scars, and I advise my patients not to use anything that they haven't talked to me about, to make sure that it's something that will be safe for the scar. Even in spite of that, sometimes people have allergic reactions to things that we do recommend, and if that happens, obviously you would stop that product. So you don't want to have extra inflammation while the skin is healing, because there's already an inflammatory process, and if you add to that inflammatory process, sometimes the scar will overgrow and you'll get what's called a hypertrophic scar, or even a keloid scar in rare cases. But so those are all important factors. I hope you've enjoyed this video. If you have any more questions or you want to make an appointment for a consultation, please feel free to contact us at newportfaces.com. Call us or text us at 949-566-1032.